Good thing. It's here. Might as well use it. Good morning. So this is the Board of Trustees meeting Thursday, December 15th, SUNY Erie Community College. I am Jeff Stone, Chairman. We are waiting for some trustees to arrive. The weather is very difficult, and we are going to have some quorum issues today. I just want to tell everyone right at the beginning so people can make their plans. As you are probably aware, we have 10 seats on this board, 2 of which are vacant, 8 of which are filled at the moment. But we do have 2 absences today. I'd like to, begin by commenting that Candace Morrison, one of our trustees, had a baby daughter, a healthy young girl. And hi, good morning, Amanda. At the end of November, and all of mom and baby doing well, and family. So congratulations to Candace, but of course she's on maternity leave and is not here with us today. And Marcel Soares Pinheiro is in his finals here at the college. So he is he is either taking an exam or preparing for one and will not be with us today. So that leaves us with 6. And Judge Carrie Phillips has a half an hour obligation on the bench, and she will get here, but it may not be until about 10:30. So in terms of action items, taking action by the board, votes, going into executive session and the like, we may be in a pause situation where until 10:30 we don't have the votes to do that at the table. There are several trustees who have texted me and said, slippery roads, I'll be there in a minute. So what I'd like to do is just convene the meeting as I did at 9 o'clock. But not for the purpose of taking any formal action. Rather, just to hear reports and have informational activity. And if we run out of that, we will simply wait for a quorum to be established. All right? So I think the first thing I would like to do is, before even calling roll, because I think that's pointless until we get a couple of more trustees here, is let's go to a presentation. I just met John Berger from Lolly, and I think, John, we've met in the past once or twice, and I think what I'd like to do is ask you to present. We have live YouTube feed. This is recorded.
Okay.
People can see it when they need to, and I see Carrie Phillips has just joined us remotely. That doesn't constitute a quorum until she's here in person, but she will at least benefit by your presentation. And we are here to talk about LMHF, and the reason we wanted to do that, hi Melody, good morning, is to say that a couple of our trustees are relatively new.
Okay.
And before you talk, we'll go around and introduce ourselves so you know who's here.
Okay.
But we thought this LMHF, which we receive a report of each month, take a look at, generally find favor with how it's doing. But want to know more about it. Want to have a good feeling as trustees about what this is, why it's established this way, how you look at the finances of it, what your general sense of history of it has been, and what your recommendation is in terms of its continued existence. Is it working for us, and so forth.
Okay.
So that's the general goal. But before we do that, let's go, as we always do at the beginning of the meeting, around the room and introduce ourselves with our role quickly so that people know who's here. I'm Jeff Stone, Chairman of the Board of Trustees at SUNY Erie Community College.
Melody Baker, Vice Chair of the Board at SUNY Trustees.
Amanda Lau, Trustee.
Adam Zagay, Provost and Officer in Charge.
And John, we know. Kelly?
Kelly Labiana, Assistant to the Board of Trustees.
Bob Tremoni, IT.
Ryan Noble, IT.
Arno Hanna, Comptroller.
Paul Daniel, Finance and Facilities.
Hi, Bill Ritter. Nice to be in person today.
Okay.
Kathy Colesto, Associate Vice Provost of IRA. Tammy Janasco, Employee Relations Manager, and Caroline Investigator.
Eric Neal's VP of Health.
Mike Barone, VP of Marketing and Communications. Jimmy Latham,
This is one Monday. John Berger.
And Len Linehan.
How are you?
Okay, thank you everyone for being here, for quickly identifying yourselves. Appreciate everyone's engagement. For the benefit of Len and maybe Melody as we came in, I convened the meeting at 9, but we don't have a quorum, and we won't for a while because Candace is on maternity leave, had her baby in late November.
Right.
And Marcel is in finals or preparing for one. So that leaves us with 6, and Judge Phillips, Gary Phillips, is on the bench and can't get here in person to create a quorum until about 10:30, hopefully sooner, but we will see. In the meantime, I did convene the meeting at 9 without a roll call right now,
Right.
but just to hear an
John
informational
Berger.
report from John Berger, other reports. If Colleen is here, I will jump around and do the Senate report and the like, so that we keep moving while we wait. We won't take any action item until we have a quorum.
Thank you.
Okay? So go ahead, John. Thank
Great.
you.
Yeah, good morning, everybody, on this wonderful December day, right? So let me give you the background and the history of the Labor Management Healthcare Fund. If you can go all the way back to 2002. I just moved back into town, quite frankly, from Richmond, Virginia. And I had met a couple people, Joel Giambra and John Greenan and Neil Sullivan and Tom Dietzick. And my firm at the time responded to an RFP saying, can you procure health insurance for the county? And at the time, the county had 6 insurance companies, 195 plans of benefits, and everybody believed that, and at the time, the insurance companies were driving the bus. So labor management would agree to that bottle of water, and one of the carriers would change that bottle of water and say, no, we're not going to make this available. And then labor management had to scramble around and figure out what the workaround was for the decision that wasn't made by them, but made by the insurance company. And this happened over and over and over and over again. So as I started to learn and ask questions from this group of stakeholders, both labor and management, we started down a path to really say, what if we could take insurance back? What if we could take it back from the marketplace and drive the marketplace as opposed to respond to the marketplace? About 18 months later, 8 bargaining units at the County of Erie on the same day entered into a letter of intent. That letter of intent was a result of about an 8-month RFP with the marketplace. The marketplace was banking that we could never come together. You could never bring together all these stakeholders at the County of Erie and have them come as one and drive the market. The market responded, and at that point in time, they decided to go to one sole carrier and define their plans of benefits. So if you could imagine going from 195 plan iterations to basically 3, that's what happened at that point in time. In addition to that, they decided to enter into a new CBA. So that CBA was one where they liked the way things were working. They didn't really want to give it up on healthcare per se. They wanted to come together and form a committee, an informal committee at the time, but a committee no less, that would say, hey, we're going to administer the plans and benefits that each bargaining unit decides. We're not going to get in the middle of that, but we are going to drive vendor performance and accountability and try to leverage the buying power of the constituent group. That happened and came together on November 1st of 2003, almost 20 years ago, at a time that no one said it would work. And over that time, over that 20 years, folks like ECC and ECMC in the town of Tonawanda and Orchard Park, and there are 15 participating employers, town of Clarence as an example, get the benefit of this buying power, this accountability, and this team of about 34,000 members. It is the biggest buyer of insurance in this region, hands down.
John, did the county did the SUNY Erie Community College, did they come in at the outset with the county, or was it a later add-on?
Good question. It wasn't, I wouldn't say right in the beginning, but it was pretty close. That was close. NFTA came on board at that same time. Water Authority came on at that same time. Because everyone was in that same boat. And the unique thing about ECC in the county, of course, was there was many shared employees. Mm-hmm. So if ASME could have somebody that works at the college or works for the county, and the same thing with ECMC. So if it worked for the county, it likely could work for the respective, I call it the affiliated employers, in your guys' case, a public benefit corporation.
Jeff, just for point of information, John mentioned Joel Giambra, the county executive at the time. He negotiated directly with all the unions in the county, and to move to a single provider, one of the things the unions got was lifetime health insurance. So there was a
An incentive.
yes, there was an incentive. I mean, the end of the day, most of that lifetime health insurance has been negotiated out of the contracts, but it did move all the bargaining units to the labor management health fund, which in the end turned out very, very positive.
So it's important to realize this is a much broader thing than just the college,
yes.
right? That's
So the
first
college is
step one.
a active participating employer in it. Governance is 50-50, 50% labor, 50% management. Andy's been on the board for a long time, a while. He's also chair of the board of directors, not the board of trustees. So every participating employer has a seat at the table, both labor and management. Some have a few more seats than others, but decisions are usually vetted and worked through with Andy and his team, and that group makes an ultimate recommendation to 8 trustees, 4 labor, 4 management, and those trustees are elected by the board of director. What decisions do they make? Hire or fire John, hire or fire the accounting firm that we do business with, which is EFPR, hire and fire Mark Stuhlmaker, decide vendors, so we do an RFP generally every 3 years, and they make a decision on that. They do not get involved in the individual collective bargaining agreements, either inside the college as an example. So Faculty Federation is their business. The LMHF's job is to administer whatever both sides agree to. That has been challenged in the past. I could tell you that I think it was the end of 2008 or 9, the town of Orchard Park wanted to unilaterally change a benefit. They wanted to remove something that they felt they could contractually. The board, both labor and management, said unless both parties sign this amendment piece of paper, you can't do that. So there's accountability, there's governance. We meet every third Monday. In addition to the buying of insurance or the financing of insurance, we do a ton in the area of wellness and health and productivity. So there are a ton of strategies that we've implemented, whether it's nutrition or fitness. We do a lot in the mental health space right now and have for the last couple of years, something called Strive for Thrive. We get that capital out of the vendors we do business with and redeploy it back to the participating employers. And that's not a small amount of money. That's about $650,000 a year. So ECC, for example, will identify areas of opportunity, whether it's diabetes or a particular disease state, and the wellness program will respond to those disease states. There's a team of people of about 4 people that do just that. In addition, compliance has become huge in our world, so you guys get the benefit. Every participating employer gets the benefit of that compliance. We do GASB 75, which is a requirement that you all have to follow. That is funded and paid for and administered by the LMHF, so that's a lift that you guys don't have to do. Open enrollment and all the support around that. We went through this project a year and a half ago with county executive pulling carts who challenged us quite a bit to basically say, prove to me that this adds value. And the biggest thing I said is, Mark, how many people do you have in HR that do this? And he had 2. Well, you don't manage 65, I don't know how many employees they have today. You don't manage that many people unless you've got the infrastructure and support. And remember, that's not only actives, but you also have a pre-65 population and a Medicare population.
So does your firm negotiate directly with the market?
Yes. Yep.
Got it. Has there been talks, or is there talks? I've been out of the space for a little bit, so I don't know. Are they still charging more for women and elderly, or women who are at childbearing age and elderly? And I say that because there's a huge problem with a lot of the organizations wanting to only hire men because it was less expensive for insurance purposes.
Yeah, no, that there is.
It's still there.
It's not there.
Oh, it is?
It's not. Absolutely not. No, I mean, the risk, the utilization of a childbearing female is certainly higher.
Much higher.
But if you look at the curve goes like this to 65. So our pre-65s are
Right.
closer to, and they're higher utilizers.
Okay.
I call them generally more experienced in their healthcare needs. And then it drops because there's an offset with Medicare.
Got it.
So we manage the finances of all of that. We know where the subsidies are, but there is absolutely no difference whether you're male, female,
Wow.
old, young, it doesn't matter.
When did that change?
It really has never been like that. It can't. I mean, there's so much patient protection and it has been forever. They can't unilaterally decide if I'm 56, if John's 56 and I have this health profile that can be individually underwritten. Now, if you've come from an area outside of New York, that did happen. So I'm not sure your background. Sorry.
Well, I wasn't in HR, but I did oversee spending and insurance, and one of the problems was upper level said these women are costing us way too much money.
So that is an accurate statement, but it doesn't mean you could charge them more than the person next to them.
Well, I'm not talking about charging the employee. I'm talking about the market charging the employer.
So you are self-funded. So in an when the insurance company takes the risk per se, when they decide those rates, there are a lot of different factors that go into their rate makeup.
Yep.
Demographics are
Yep.
one of them.
Yeah.
Their experience is another one. Their historical experiences of their prescription drug use. There's probably 7 or 8 criteria.
So that's what I'm talking about, the rate based on the demographics.
It's a component, but when you get over 150 lives, it's mostly your experience and not your demographics. If you're under 100, maybe, but most of that stuff is community rated, meaning it gets spread out and blended across all their population.
Got it. So the benefit is if you have 150 employees or more.
Roughly, each carrier does a little bit differently, but yeah.
Okay, but that is still in there.
Yeah.
So
It
they
doesn't
still
in-
factor in the demographics. So an organization will get a higher rate based on their demographics.
It's mostly utilization driven. And our job at Lawley, which we handle almost $2 billion a year in medical insurance, is to negotiate best terms and conditions for all our clients. We just leverage this group, 34,000 members. Kaleida is my client. Buffalo Board of Education, that's also a customer of mine. So we leverage the big buyers to try to get best terms and conditions and things
Got
like
it.
that.
I know Kathy. Yeah, she was great. I worked with Kathy
Oh,
Lawley.
great. Okay, super. Yeah, Katie Best.
John, could you take a second and
Yep.
just clarify? You talked about us being self-insured, and
Yep.
what I want to make sure I understand is, are we simply collaborating with others to use collective bargaining power to get more advantageous coverage from insurance companies, or are we pooling and self-insuring with maybe a umbrella protection?
The latter. The latter. So you guys decide, and I'm going to pick on Andy because he's fun to pick on. So Andy negotiates a plan of benefits and a contribution. So the two things in a collective bargain, it's its simplest form says, what are you entitled to get in terms of the access to benefits, and how much are you who's gonna share and what that cost looks like. That's, in its simplest form, that's how it works. Their job is to make sure that they finance it as efficiently as possible. So they don't get involved in your deal per se. They don't get involved in your plan of benefits. In fact, if I were to put a spreadsheet on all the plans of benefits, it might be as long as this table, because we don't care. What we care about is, can we finance it as efficiently as possible? So how do we do that? You guys right now have 385 active subscribers. Those are your active employees. If I were to go back to July of 2020, you'd 654. I don't need to talk about the census of the college and the students. You guys all know your business. But that's where your population was and where it is. Your buying power on that is less today than it was 2 years ago. But this won't impact you at all because you're part of a bigger group of people. So we get breaks on administrative costs. We get breaks on the formula. We have an agreement in place that sets the formula each and every year. Blue Cross and Blue Shield gets a small increase in their administrative fees, mostly CPI, about 2.7%. But where we do buy insurance is every claim that is capped at $250,000 on the medical side. That means if we have God forbid, a very large claim, let's say $1 million, $250,000 of it is absorbed by the college, and anything above that's paid for by the insurance company, in this case, Blue Cross and Blue Shield,
That's
Highmark.
that umbrella concept, or you know.
Yep. So the self-funding works is everybody gets a rate, everybody gets a published rate, and that is effectively a worst cost or maximum rate. So from budget purposes, every municipality says, this is great. I know what my worst cost is going to be each and every year. I can bank on that for budget. And every employer handles that a little bit differently. Your actual budget is not what the max is. It's a little bit less than that, but everybody has the benefit of that. You only get charged what you use. So if your utilization goes down or your claims in a particular period are good, you only pay what you actually use. If you go above that worst case scenario, you share risk with the other employer groups. And the concept is you're going to have a bad year. The college had a bad year in 2016. I'll give you that history and the collaboration that needed to happen. And when that bad year happens, every other participant picks up the shortfall on a prorated basis.
Interesting.
Okay? One out of 5, 2 out of 7, you're going to have a bad year. What drives bad years? Generally claims between 50,000 and that 250. If you get a predominance of that, it becomes a problem. So we are constantly measuring. If you were to look at the board book that we do in September, it's this big, and we go over a ton of utilization and stuff. So everybody knows how they're running in terms of the individual employer and then what the LMHF looks like in the aggregate. Every month, everybody gets a scorecard and a measurement against that worst case or maximum, as an example. Right now, and you're welcome to, I'll hand this out. Right now, through November, there are 2 groups that would be running short of the maximum. One is ECMC, and I'll explain that in a second, and the other is OTB. OTB is running a deficit of 219,000. ECMC is running a deficit of 1,628,000, but we have to do a manual offset because they were running employer-required testing, COVID testing, through the health insurance. It was easier for them to do that. One doctor would set every 2 weeks, an employee would have to test times 3,400 people. We ran it through here, so you won't cross-apply on that. ECC won't cross-apply on that.
John, let me just interrupt you briefly. Just for the record, Kelly, Trustee Wilson joined us about 9:18. We now have 6 trustees listening. That is the total maximum available number of trustees today. It would be a quorum if Judge Phillips were here, but she isn't. So when she gets here, that's when we will have a quorum established. In the meantime, Denise, we're continuing to take informational reports.
Quick question.
Yeah.
So Judge Phillips is not able to be a part of this because she's not here physically?
She could have been before COVID, or if we identify where she would be as a separate location of the meeting.
Got it.
But
Yep.
because she was able to come and will come, we didn't do that. So it was easier to have a quorum in this manner but during COVID, and that got changed
Got
a
it.
couple months ago. Before you go on, John, I just want to give you a chance. I know Jim and Andy are here. You had a hand in this. Len, you probably did when this was done at the county level or started. Does anyone want to comment on how this is working for you or add anything to the history that John has outlined before he goes on?
Joe, I'm sorry, I didn't catch.
Just looking for those who have a hand in this. Bill Reuter, Len at the county,
Sure.
folks who organize labor. How is this being perceived with your folks? And what's the history? If you want to add anything to what John has said or what Bill said, or Bill.
I would just say multiple different fronts I've been involved in. It's been a good concept. It's been functional. It's worked. I have not even seen a lot of complaints along the way. I don't know if there's ever been any shakeups resulted in maybe governance would change a little bit, but I think the union, Jim Lakeman and others would be in a better position to more day-to-day stuff. But overall, it's something that's worked, I think, effectively well for a long, long time.
Jim or Andy, do you care to comment on this?
I just think, to Trustee Baker's point, the community rates and everything for small employers, I think it just helps to be in a bigger pool that you can distribute the costs similar to pensions under the Taft-Hartley Act. So, I think you're at an advantage because you're fishing out of a larger pond and you're distributing the cost better.
But I think because we are, yes, I agree. I think that we have more buying power because we're a part of this group. So we get the better rate, but individually, our numbers are not with everybody else. Is that correct?
Yeah, so your cost
Right. All right.
is your
Based on-
utilization plus about 6 or 7% in a combination of administrative costs and stop loss. But you couldn't get the rebate offset that you get if you were standalone.
Right.
That's one of the benefits.
Mhm.
The second benefit is that could the college afford to take the risk 100%? So if the college has a bad year today, and can you afford $1 million shortfall in your operating? You haven't had that, but as an example, that's one of the other benefits is that as a standalone entity, could you afford to be in that self-funded business? Likely not. And the reason why is, and you're not different than everybody else, you have 100 and some people that are pre-65 retirees. Remember, that population effectively gets the same rate as an active, but their usage is much higher than the average active employee. So we blend that. And if we've always run utilization on that. The average age of the college has always been higher. So let me go back to 2016. If we were in this room in 2016, actually we were downtown, and you guys were running a deficit of $1.5 million. Percentage-wise, it was off the charts. Worst year of all time. We dug into the utilization. We learned a lot of things. One, that the average age was substantially higher. We know that we had people that were eligible for benefits that might have been teaching 2 or 2.5 or 3 courses, but still participated. Your average age was higher because the adjuncts that you had here could have been 75, 80, 85 years old, still actively working and in our pool of risk. No Medicare offset. So if you could imagine how many people were in that room, Andy, that day. Bill, you were there. It was like 20-some people. Every bargaining unit. And it was like, do you guys remember the movie Houston, We Got a Problem? Houston, we got a problem. Because at the time, $1.5 million, who picked up 3% of it was the county, and then everybody else. So you guys were at risk of being kicked out of the club, for lack of a better word. You came together, you came up with a retiree incentive, you got your demographics in terms of your age where it needed to be. People took that incentive plan, and you had to have a self-sustained rate at that point in time so the others wouldn't take that risk. And since it's worked out, knock on wood, very well. Data and information was never argued. The one thing that we bring to the table is, mostly in bargaining, you argue over the facts. And then you try to negotiate from there. But 90% of your time is, Len says it's left and I say it's right, and nobody can agree. Our job is to present the facts to both parties and let them negotiate from there.
But see, that's one of the challenges that I struggle with, is that I do believe that people in your position should do a better job in terms of negotiating with the market. When you say get your demographics in check, I know what that means. That means, like, it's not necessarily that this person needs to go because they need to go, it's because they're making our rates go up. And it's the same thing with women. When you have way more women that are in childbearing age, your finance folks are in there like, listen.
And the example that I had just given had nothing to do with male, female. It had everything to do with
I know
people
what you
that were eligible,
Right.
that were eligible
Within a
in
utilization
an
rate.
average age. I mean, the numbers were astounding.
No,
I'm going top ahead. I think
I agree.
130 people ended up, something like that,
Right.
ended up taking the early out because the average age was almost 60 years old of your subscriber.
I agree, but what it does in terms of demographics, it pushes you, especially if your budget is tight, just to look at a woman and look at a man. And I know you weren't talking about women or men, but it is the same way. Women are way more and I mean, if you're struggling, you look at the woman and the man and you look at your budget and you're like, I can afford this woman. And so I'm just saying, in terms of having a firm that can negotiate with the market, they should make everybody the same rate.
We
so
do.
that-
I'm gonna say it again. I've been doing this I'm 56 years old.
Well, now-
I have never once said male, female. I do talk about pre-65 retirees because they do use
Well,
it a lot.
I'm not saying that you talk about male, female, but the truth is, females do cost more that are of child.
At a point in time, they take much better care of themselves than John does. So in that time period, from let's call it 25 to 35,
Yeah, childbearing age.
I would agree. But John
They're
Berger from 35 to
expensive.
56, I'm the problem during those 20 years.
Right.
So it balances itself out over the long haul. In your guys' case, going back to that 2016 collaboration, it worked. You guys had an early out, and we haven't had, knock on wood, the college hasn't been out of balance since. If you look at your costs, and I just gave you guys what we call it a place map. Let me just show you how to read it, what's in front of you. This is the college year. So this is September to August, and it's not right on your financials, but it'll be relatively close. We try to reconcile it off your GL. So anything you see 19, 20, 20, 21, 21, 22 is the recommendation, 21, 22 is actual, and then you could see 22, 23 projected. The number I want you to look at is all the way to the bottom of the chart, which starts with 10,371 and is projected to be at 10,648. When the dust settles on all this, cost, less payroll contribution, less any offsets like we have rebates and those sorts of things, your costs over that period of time on a per capita or head count basis have averaged just under 1%. That's your cost. We move your rates because we move your rates associated with the LMHF. So your worst case rates are going to be higher. But in terms of what it means bottom line for the college, you guys have been relatively flat. That beats inflation, which is, we don't have that many
I'm just
times.
saying for employers, I get that, once you get out of this stage, when you're no longer 35 and you're now a 50-year-old woman, or for this window, you're not going to be as expensive as like a heavier user that's a little bit older. If you're saying that these rates balance out, the expensive women and so forth, they balance each other out, it helps out the employer in terms of being equitable and making equitable decisions if everyone was just the same price. Because demographically, if you have way more women that are of childbearing age, those women are very expensive. And if you're keeping an eye on your budget and you're struggling to make ends meet, you're gonna see someone else who might fit a demographic that you need. And you're like, you know what, I can afford this guy and I'll teach him. And I'm not saying that you're saying that, but what the truth is that women are very expensive, the ones between childbearing age. And if it does in fact balance itself out, then everyone across the board should be the same cost. That way, as the employer, you're not thinking about your budget as opposed to who's really the candidate that I need.
So if you go 2 more pages, these are your plans of benefits. Sorry, the print's a little small. These are your plans of benefits, and these are the participants by plan. So you can see that as an example, you've got in your point of service, in the core plan, you've got a $10 office visit. In your Core Plus 2040, that was a new plan that was negotiated, I think, with Andy's group. You have a value plan. And really the difference between each one of those plans isn't access to care, it's how much you're going to pay when you go for that care. You can see the rates don't change. They're all the same rates. It doesn't say...
I'm not saying that women get charged more than men. I'm saying that the employer gets charged based on their demographics. The demographics are a part of this algorithm that then determines how much the employer pays.
No, you get charged based on your utilization, based on your claims. So yes, you're going to have people that are going to have children, and it's going to be in your utilization. And just like my situation with my stuff that I have to do with, that's going to be that's going to be in the same utilization. That's what I'm saying. It moves itself out. I'm not about to speak to any employer that participates in this around how they hire and they look at that stuff.
No,
I don't know.
think
I just do
hire
health
that way.
insurance.
I don't think they should hire that way.
What's the yellow band?
Oh, the yellow band was just to show the head counts,
Oh,
just to draw your eyes to that.
okay.
So these are the plans that we don't get into. These are the plans that we administer that the respective bargaining units will decide what they want to have or don't want to have.
Got it. Okay.
So if I go back to page 1, this gives you a sense of what cost has been over a historical run. Your head count change, as I had said before, with the census at the college, census being employees, has changed dramatically since July of 2020. You're pre-65, so you could see in October of 2022, with the changes, some folks did retire, so your pre-65s went up. And again, they go from your active pool to your pre-65 pool, so it doesn't change utilization per se. If I go from working one day and not working, it's still John. It doesn't really. But if it's a lot of Johns, it does have impact. You did have some people increase in terms of Medicare Advantage, and effectively that is what the census is. Again for the college, we project often. So when we do that, we work with finance and HR and the bargaining units and give you guys our best guess of a crystal ball so you guys can budget and understand what that is. We're always looking for ways to, we call them levers to control costs. So we have drug programs that incent engagement. We have drug programs that waive any sort of copay, because if we have a specialty drug, we leverage these monies we can get from the manufacturers, as an example. We do a lot in the area of the wellness, as I said before. We've done dependent audits from time to time. So a few years ago, we did a dependent audit, right? So the intent is to provide coverage for those people that are eligible. My job as a subscriber, if I was on your plan, is I evidence that my child and my spouse should have coverage, but where games are played are generally in divorce situations. The judge says, John, I have to provide coverage for my ex-spouse. That doesn't mean the college has to pay for it. It means that John has to pay for it. So we have a lot of checks and balances around who's in the plan and who should be in the plan. You probably read 10 plus years ago, covering dead people. It never happened in the LMHF. It did happen in the city of Buffalo. We use a death master, so we're constantly looking at the state pension and whatever access databases we can have to make sure that we have the right people and that they are covered. Every month we report on this. Page 2 in your information, and I do have an update of November if anybody's interested, but I want to walk you through how to read it. I highlighted ECC for you guys. So the top is the worst case. So Chairman, this is the worst case maximum. So this is what everybody likes in terms of budgeting. So that $1,442,000 is worst case. There are two pieces to that. There's the admin that's paid to Blue Cross and Blue Shield, which includes stop loss and a tax. And then there's the Medicare Advantage medical portion of that. So that's through independent health. The health max is the worst case that we negotiate with Blue Cross and Blue Shield. If we negotiate that max going up by 4%, every employer gets 4%. So they get the benefit of the bargaining of the group. Even though one group may be running a little bit worse or a little bit better, that's the sort of win together, lose together. You can see the RX premium max is $4,983,000. Why it's pretty close to medical is we have 600 people in Medicare Advantage. So those people take the drug, and that's why your census is now becoming over 50% for retirees versus actives with the census of the college changing. I'd mention offset, so we get rebates. We pass that on in the form of rate, so all plan participants get that. And then we have another subsidy called EGWIP. EGWIP stands for Employer Group Waiver Plan. That's a government subsidy that we use to offset costs. We lessen the rates by that. Everybody gets the benefit of that. Below that are the actual expenses, so you can see the numbers in each one of those categories. The delta for the college off of not your budget, but running the insurance company per se, is through August is $1,378,000 or 11.2%, and through November, again calendar year, not your fiscal, is $1,506,000 or 9.23%. So every month we go over this, we go over any outliers, and it's reported at the board meeting. Below that column in gray, so we are conservative when we set these credits. We don't want to give them all away, because if they change, you could get a big rate change. So we always keep about 25% of the forward-looking years projection in-house, and then we get true-ups on that. So there's about almost $20 million, and your portion of that is about $1,260,000 roughly, meaning that money is used to offset future years' rates, but it is shadow accounted for Erie Community College.
John, excuse me. Across the top, we see various entities,
Yep.
counties, authorities, towns.
Yep.
We don't see every town.
No.
My town of Grand Island is not there.
Nope.
Many others.
Nope.
Why do you think Grand Island or other entities would look at this that you're presenting and say, you know what, I don't want that. I'm gonna go on my own to the market or whatever their alternative is. What do you encounter as the arguments against this?
For 20 years, we've presented probably 200 times to municipalities. It always gets lost at the bargaining table. Labor management can't agree, can't come together.
Okay.
One gets forgetful, one gets greedy. There's always money on the table. but getting them to come together is key. And if you think about Grand Island, and I don't know how many bargaining units, but let's say you have 4, you have to get all 4 of them to agree. So the key to this arrangement is collaboration and communication and transparency. Some people don't want to do that. I mean, the list is really long at how many meetings we've had. The County of Erie gives away money in a shared services grant. For every dollar they save, they give the municipality 1 time. Pioneer took advantage of it, and East Aurora Schools took advantage of it. But it's one that, you know, it takes time, and we're pretty selective. We don't want to go into a situation that's adverse, labor management's adverse. We want people that you could, you know, try to collaborate and figure it out.
Let me just make sure, Andy, I don't know if you got a chance to comment earlier about this in general, or if you had any comments.
Well, I think it's been a very good way for us to leverage care for my members. I also think that one of the things that we were able to do, we were able to settle a contract by making adjustments and working with the college in a collaborative manner. So, you know, the overall healthcare benefits package that we have, you can buy up to. They're very, the utilization, the wellness activities, all of those things are benefits that really help so that the costs stay down. And, you know, we've kept a handle on Blue Cross Blue Shield and others to make sure that they're doing the right thing and servicing people as well, so we don't run into these long-term catastrophic illnesses. So that's really the thing that I think is most effective.
The huge cost drivers.
The huge cost drivers. Plus, you know, we've been running a surplus for the last few years too, so that's been helpful to my members in keeping rates down and the college. So it's been a win-win for everyone.
Yeah, I commented on that just about every month when I mentioned that budget and audit. Oh, it looks pretty well. But take a look. You see, ECMC is that, you know, that bad.
That's a testing. They do $3 million a year in employer required twice, so you're not going to cross apply against them.
Yeah, yeah. But I mean, it just shows you how people can be positive, can be negative. We had a bad year,
especially the small. Excuse me, especially the smaller ones. Town of Clarence is 100 people. So remember, a $200,000 case for them is much more impactful than it would be for the college.
Sure. Yeah.
The one that has been a little bit fluid these days is OTB. OTB census has dropped. They have a pretty good size pre-65 population. They were also rated on a self-sustained basis before the college was. I think it was in 2011. Gosh, if you were to look back 20 years and say, did you think it would get to this? You'd say no. But it still works, and I will tell you right now, with what's happening with Highmark coming in our community and everybody trying to migrate, I wouldn't want to be on a standalone basis. And Lawley is humongous with them, but you know, it's different. Everybody's moving over to their eligibility platform on 1/1. So as I was talking to Bill about it, you could imagine 300,000 people having to have their group number, their member ID, their eligibility uploaded through their employer and on time before 1/1. It's a pretty big task. We get to the front of the line. Simple as that. This is their first client. The Buffalo Boards are second, and Collide is their first. And when they did this, it was their wave 1. So the cards have already been mailed, and you know, we certainly leverage that in your guys' behalf.
Well, I think we should probably wrap up.
Yep, I'm good.
I just think the idea of this was to put a spotlight on this rather obscure part of our monthly meeting, and recognize that we have Lawley in place as a resource if you do have questions or comments, such as, you know, Melody's comments. And I think it's good that we gain just a better understanding, especially with several new trustees. This may not be immediately completely clear to everyone, but at least we know where we are, that there's a long history here, that others have joined in this, and that, you know, there are arguments. And I guess I'm glad on some level that at the county and college that labor and management, organized labor, were able to, you know, get together and do something that both perceived to be positive, at least at the time, and maybe still. So I haven't had any big complaints about this. I just felt a sense of uncertainty about the details.
Yep.
And I'm sure my other trustee colleagues did as well. So, we'll certainly reserve right to call you.
Anytime.
Bring you back. If you see something odd happening, please let us know.
Cynthia
That we
and
should
Andy
know,
will know
but
for sure.
I think this at least advances the ball in
Yep.
terms of our understanding of where we are with this.
Let me give you one more fact because I think it's really important. So Vicky Martino is the executive director. She has 9 people that work for her. They do everything from wellness programming to front-end customer service to all the open enrollment support, GASB 75. Everything is shadow accounted, so money comes in and out. There's not other than the money that's in the rebates box down here, they manage all the financials for you. We are also part of that team. 1% goes towards funding them, and Lawley makes 35 basis points, 0.35% of that. So the other reason that others don't generally want to have us involved in is there's other brokers and consultants, and they're going to try to protect their little fiefdom, if you will. But I did want you to know that. So you are investing in it. Everybody's charged the same amount, and those financials are always go over every month, right, Andy, at the board meeting.
Quick question.
Sure.
On average, I guess within the last 3 years, because I know costs change, how much has health insurance increased?
Yeah.
'Cause I know it never decreases.
Yeah. So remember, COVID was we call it the dip. People
Right.
couldn't go.
Right.
So it was in the 1.9% in that period. We moved it up to about 4 and change. This year we moved it up to 6 and change. And the reason we did was the Kaleida contract. So if anybody knows reimbursement negotiations and you're reading about Catholics right now, and that's a fight, it's a community issue. And you can blame the big old insurance company, or you can blame the hospital. But at the end of the day, we still don't have that done, and I think that's a big issue for us as a community. But in the first year of a hospital contract, they front-end load it. So if Kaleida got $1 in 1 year, they're getting $1.07, and then the average comes down. So they average over a period of time a higher amount, but year one, so we knew it, so we're responsible in setting the max a little bit higher. We're right now in November, we're running at 2.6%. Here, I'll let you guys look at that. Here's November's financials. We want to be plus or minus 3%. We're at 2.6% through 11 months. That's probably more luck than anything, but we'll take it.
Okay.
So yeah, community rates went up a lot this year. So community rates were flat, and in 2023, 1/1, they went up on average about 11%. And some of that has to do with
11%?
11 on average. Yep.
That's the highest I've heard in a long time.
That's the average. If you're in a certain plan, it could be 14, 15. In the individual market,
That's how much it increased?
yeah, and the individual market went up by 15 to 18.
Oh my.
So if anybody goes to the New York marketplace and gets a subsidized plan, it went up substantially.
John, does Kaleida's current financial situation, they're projecting losing $120 million this year. Is that going to come back and bite us as well? Is that?
Which hat do you want me to wear?
Well, I'm just saying. Oh,
I'm going to wear my community hat.
right.
We should be concerned as a community. We have our 2 health systems and every health system is losing money. All right, so if there's a health system that's making money anywhere in the country, it's a miracle. But at the rate that we're losing money right now, somebody's got to come in and save it. And who can that be? Hopefully it's a bank or some philanthropist that wants to do it. But if it's the insurance company,
Right.
and I'll deny saying this, if it's Highmark that comes in and saves Kaleida, now you got the fox watching the hen house. And now it becomes quality of care, access, all those things that are
Things
really
tighten up.
important. Right. And that's what I get worried about.
Right.
Okay.
Okay?
Well, John, thank you.
You're welcome.
Appreciate
Thank you
the
for
time you spent with us
inviting me.
today. Yep.
Tell Mike I said hello.
I will.
Thanks.
That's it. See?
Thanks, John.
Okay, you're welcome.
Apologies for not following the agenda precisely, but what we have to do is jump around until we have a formal quorum. I think Adiam, I'd like to ask for you to report as officer in charge with whatever items that you have in mind while we're in the reporting and listening mode instead of taking action mode.
Sure, absolutely. Good morning, everyone. Let me just start out with, really taking this opportunity to thank, number one, our students, as you know, our faculty and staff, and certainly our Board of Trustees and all of our constituents in the community. To support the college, to continue to move us in the right direction, it really takes all these people to do that. So I just want to start out with thanking everyone on that note. I think following the same thing that we've been talking about in terms of who is the college, that's our students. So with that, a student first model as well as student empowerment, one of the things that the college is going to do starting next semester is highlighting students. How do we highlight students to bring, perhaps maybe to bring some students here at the board to highlight some of the things that they're doing academically, also serving the community. So we are going to be working on that to bring some of the students here, as well as bringing some students at the Senate. I think that's another opportunity for us to highlight our students in front of the college community. Some of the things that we're doing to make sure that our student experiences are in line with the college's mission and vision. One of the projects that we're working on is the revitalization of the student lounge at the North Campus to make sure that it's student friendly. And one of the things that we have done is survey those students to see what type of look they want. I'm not sure if everyone is familiar with the student lounge from the North Campus and S building. It's not student friendly, so that is our goal, is to do that, and that's working with the student government to make sure that we are revising that atmosphere for those students. The other thing that we're doing is our food pantry. Part of it is location. It was not student friendly, right? So they had to go to another building to be able to get food, right? So that's the other thing that we did, is relocate the food pantry so that it is close in proximity where the students are. But more importantly, it's attractive as well, right? It needs to be user friendly for those students, not for us, but for those students. So that's the other thing that we're doing. Now, I just want to put this in perspective. We're trying a campus at a time. So this is the North Campus. We're going to look at the city campus as well as the South Campus to make sure that we're focusing on that. My favorite time of the year, commencement. So put this on your calendar. May 24, 2023 is our commencement. And we're doing something a lot more student-centered, academic center, so that we want our faculty to be part of this, and they have been in terms of the committee participation more than any other time of the college, as well as making it so that it is recognizing academic excellence for our students. So that is something that we're working on. The other thing I think sometimes we don't spend some time is really recognizing the academic excellence as well as the services that our students provide, not only for the college, but for the entire community. So how do we recognize that throughout the year? Not just at commencement, but really throughout the year. So that's the other thing that the team is working on, is how do we focus on these academic excellence, on these accomplishments that our students are doing. I think all of us have a common denominator, and that is the success of our students. So I think highlighting that is going to be a key. The other constituents that are key to the college is our faculty and staff. We cannot operate without our faculty and staff. So how do we revisit that and also recognize their accomplishment and highlight some of the things that our faculty and staff are accomplishing, not just once a year, but throughout day-to-day of their operations. So again, with the idea that our asset as a college is our faculty and staff, starting with our students. How do we do that? So those are some of the things that we're focusing on and that I wanted to highlight. On the college operational side, right, so we have to run the college as a business. What does that look like? So one of the things that, as you all know, we've been talking a lot about our ERP system, how do we engage our students in the ERP system. And so we've been on a Workday platform. The college has entered into the discussion about Banner. What does that look like for us? So right now, after some conversation and some research, the college has decided that we're gonna put this on hold until further discussion. So we are doing that investigation. Again, as everyone know, maybe into some of the new trustees may not, but the college has been in the workday and really trying to make sure to get this platform right. Again, it's all about our students, to make sure that we do and make decision that is going to benefit the student, but ultimately also the college in terms of its financial stability, as well as the human resource that we have at the college.
Can I ask a question
Sure,
about
sure.
the banner system? 'Cause
Sure.
I thought we had been moving towards that direction where all the other SUNY institutions are on that platform, understanding it was gonna be a big chunk of change for us, but we knew that.
Yes, so I think part of that finding that we're doing is exactly that, to make sure at this point, because we gotta remember, we invested in Workday.
Yeah.
So at this point, what's healthy for the college? So there are some benefits to being part of the SUNY system, no doubt about it, but part of our challenge is that we made a decision that is going to impact the future of the college. So if we are gonna make another decision to include a new ERP system, while we are operating on two other ERP systems, we have Colleague, Workday, and now we're getting into the discussion of Banner. What does that look like for us in terms of our stability? So yes, I think that was the ideal, but because we find ourselves in this situation, we need to make sure it's the best fit for us in terms of our financial, as well as the ability for us to function in it as efficient as possible.
And
So-
what's the time limit on it then for revisiting it?
I could mention, this came up in the technology committee meeting about 7 to 10 days ago.
Yep.
Carrie's not on, but at that time, additional information was asked to be presented to the board about this whole question.
Huh?
And so we'll be looking at that as a board and getting everybody up to speed on it. But it was a matter of the board, I think, wanting to, or that committee at least suggesting that additional information upon advice from senior executive staff be presented to the board so we can carefully evaluate this.
Okay.
So that's where we are. It's a little bit paused until the board takes in additional information about it, which actually, is happening.
Yes.
So,
Yes.
but good, it's the right question. Go ahead, Anna.
Absolutely. The other focus for us is realignment of our three areas of the college, right? Academics, student affairs, operational. And when I say operational, I'm referring to our HR, IT, all of those entities. Part of what we have to do is realign programs and initiative within the appropriate. So let me just give you an example. Student affairs, right? So enrollment is under student affairs. What we found, myself and Dr. Nielsen, is that there's a lot of areas where there are programs that are misplaced. An example is our EOP program. It is an absolute enrollment initiative first. Not to suggest that it's not retention and graduation rate, but how do we make sure that we realign these different initiatives with the college to make sure, number one, we're serving the students. Number two, we have a strategy to make sure that we're supporting those different programs. And really the other piece is that to make sure that we have accountability when we are doing that. So those are some of the things that this is just a process we just started. We just started with enrollment and we're gonna work our way into that. HR is heavily involved in this process. As you know, we have a lot of laid off individuals, but also we have a lot of individuals who have left the college where we need to really revisit how do we restaff and what does that look like for each of the area. But before we do that, I think realignment of those areas is critical. So that's another focus that we are doing. The third focus is really course and schedule optimization. Because part of that is that how do we offer courses given the enrollment trend that we have and the way our students are taking the classes. We're working with the faculty who are part of the scheduling committee. They are part of a task force to really look at that, to really look at a couple of things. Number one, what is the pattern and how we offer courses and scheduling? Number two, what are some of the things that we could do to enhance our service courses, like the English and the math? And then how do we, what type of software perhaps can we look at as a college? Because right now, our course scheduling offering is done manually, which is a lot of work for us as a college. So we are looking into that, so that more to come on that. The other piece, sort of SUNY Erie relations. we are participating in Niagara Community College is hosting a cannabis conference on January 10th, 2023. Part of that is that SUNY Erie, Genesee Community College, Jamestown is part of that conference. So we will be participating in that initiative to be part of that discussion in the cannabis initiative. I did participate with the Foundation Board of Directories last week. Very informative discussion with them in terms of how the college and the foundation and the different projects, initiatives that they have, we could work with them and to make sure that we expand our footprint, but also to really get some ideas so that they are participating. We did talk a lot about our strategic planning for the college and where does that foundation fit in that. So more to come on that. Amherst Advisory Meeting, I participated in that one as well. A lot of exciting thing happening in the town of Amherst. We are part of the discussion in that in terms of where we will participate and how things are going to be funded. So more to come on that. Chairman Stone and myself attended the Buff State Holiday Gathering. I got to tell you, it was really uplifting and met a lot of folks. But I got to tell you, the different meetings that I've been attending over and over again, what I see and hear is our alumni. Myself being an alumni and part of a SUNY sort of product, to constantly meet people that have been part of our SUNY community college and their experience or their kids. I got to tell you, I was talking to two individuals who they're working on their grandson to come to SUNY Erie. So one of the things I told them was to come and see me because their grandson I'll take care of. So I think they're excited about that. So I am too. Another thing, leasing opportunity. We are in discussion with different entities, both for the South Campus as well as the North Campus. We have a lot of opportunity to lease out, working with Paul Daniel and Bill Reuter and others to really work through that. So more to come on that. FEMA claim, as you know, our winter storm for 2022. There's a potential for the college to be reimbursed about $200,000. So we're all excited about that, and we have put in all the necessary paperwork.
How much was that?
$200,000. We will ask for more though. So no worries. And then the last thing in terms of the business side of the college, more to come, but really just this one, I believe tomorrow, myself and Arda and Bill, we're talking with the Erie County Fiscal Stability Authority, part of their board meeting, so we'll be talking to them tomorrow. The last thing I think, I think it's important that we take a moment for what happened this year, not only just locally, but nationally and globally. As we reflect, and this is the end of the year, and certainly the end of the semester for our students, gratitude is key, right? And so I think it's important we take a moment to think about the incident, the top shooting that took place that really touched a lot of our hearts and a lot of our community directly here, but certainly there have been so many other things that took place nationally as well that we need to recognize. Also, our colleagues, we lost a lot of folks this year, at least more than I've experienced. I think it's also a moment to take the time to thank those individuals, but to think about their families as well. So I think gratitude is key. I think being here is another place that we have a family. I know we spend most of our waking time at work at our college, so this is an extended family. So with that,
Comments very well taken.
thank you. Thank you, absolutely.
I'll pick up on that and just segue over to a few board chair remarks from my part. You talked about gratitude as you finished up your remarks, and last month I began mine by particularly thanking fellow trustees, these community volunteers who come in and contend with an array of issues and problems, each other, but we all always have stayed together very well, and I've greatly appreciated that, so I underscore that from last month. But this month I particularly would like to comment on those in the college who are just soldiering on day to day during uncertainty and difficulties. And that can come from a lot of different sources. I was talking to Len at the end of last board meeting, and he said, Jeff, in the public sector, any large organization that operates in a public space, things are just going to happen. you are going to have to deal with a lot of things that all of us, we're talking about it. And you don't know where they're going to come from or what nature they will be. So the key is just try to maintain a clear sense of ourselves, what we care about for the institution, and try to be thoughtful and considerate as we deal with whatever the problem or the uncertainty may be. And I just wanted to say that, and again, thank fellow trustees for following that model, I think, very much across the board. But looking at the people sitting around the room, everyone in a different role here, it's just, I just want to thank you here at the end of the year, wish you all happy holidays, and whatever it is that you're bringing to the college, or that you're continuing to bring to the college, even if it's under a difficult situation at the moment or whenever, just know that you're seen, we appreciate it, and it's a real hallmark of this organization as a whole that people care about it enough to hang in there and put one foot in front of the other and take on these issues that, Len commented to me about, that, just whatever it may be. Every month we have a new set of things to talk about, and we always will. But we appreciate everybody staying on course and keeping the goals of the institution in mind. So that's what I wanted to say this month. I did enjoy that outing for the Buffalo State group. It was interesting to be it's still in a higher educational circles, but seeing different folks. Tremendous amount of community leaders there. I spent a lot of time talking to folks, and that's kind of par for the course with what the board services involved for all of us. It's not just the meetings. There's phone calls, there's emails, there's receptions, and things where you are interacting and hopefully advancing the interests of the college in a thoughtful way. So I thought that Monday night was an example of that, and Adem, thank you for being there representing the college. So I think I'll stop there. And I don't know if Colleen Quinn is on. I don't think I saw her, but Colleen, if you are, and you wish to give a Senate report, this would be a good time for it. I don't think I see her. So I'm going to
And
take...
Trustee Stone,
Yes.
I'm trying to buy myself some more time, but I really need to leave around 11 o'clock.
What time do we have? 'Cause Carrie is on her way.
I know she's going to be here at 10:30.
Yeah, and then we'll have to do all other
I'm
approvals.
trying to
then.
buy time.
Okay. Yeah, we've got a tough situation with not a full board. Student trustee report will have to be deferred because Marcella's not here, unless anyone has a student-oriented comment that they would care to share in place of that. Old business, without taking any action, the state of the college thing.
I'll let you know.
Sorry, did I miss
No,
put a
they-
hand
We
up?
just heard footsteps.
Oh,
Like,
good.
It's not Gary.
I'm going to take advantage of the few steps I have here. State of the college, that is something we deferred until the first quarter, but we are not leaving it off the old business. Kelly, keep it on there, please. That's the presentation to the community on the state of the college. We also have Melody's question that some of us joined in, which was about the Board of Trustees actually participating in classes. And Nadia, do you want to speak about that?
Right, I still need to follow up.
Okay, but we could,
That's
okay
okay.
deferring?
That sounds good.
Okay, but keep that on the list as well as an item of old business. Just before, lest it get lost in the sauce, our next formal scheduled meeting will be January 26th. We do have a change in our meeting schedule, but that comes under the need to approve it, so I will wait until Carrie is here. But we have changed 2 meeting dates to save time later, based on people's schedules and to try to get the maximum number of trustees participating in person. Let me just see.
Enrollment, if you'd like.
Yeah, that'd be good. Eric, you want to talk about enrollment now? This would be a good report for that.
Great.
We're close to being at full strength.
Perfect.
Thank you.
Good morning, board, and thank you for taking the time this morning. I'm happy to present with regards to our current enrollment, both for fall, I'll start with, similar to what I've done in the last few meetings, and then talk about where we are at this point in time for spring. So what you see in front of you here is our fall 2022 enrollment as of last week, Friday. What I've switched our comparison to is what's identified as our end of term reports that does go then to SUNY as our comparative data. Given where we are at this point in time in the semester, that's what you see EOT here standing for. So overall, I think big picture and looking at where we were last week and where we're trending towards, I think we are seeing what I've seen in other reports across the county is somewhat of a stabilization in terms of the enrollment overall. One of the promising areas, and we saw also this across the country, is our number of concurrent high school students, up 11% in terms of overall head count, but a pretty significant gain that you're seeing in terms of our overall FTE, meaning that those students are taking quite a few of them our classes in terms of the credits that they're taking at that high school level. So very much appreciated to Cheryl as well as the faculty in collaborating together with our high school partners. And it's one of our objectives moving forward is to increase the number of schools that we are partnering with, but also then what our offerings are within those schools, certainly within the collaboration of the faculty, and making sure that they're still getting the same outcomes as they would if they were here at our campus location. Other promising area, I think, as well, is if you look at our number of quote-unquote new students, so this will be looking at our new first-time students as well as our transfer students compared to last year. In terms of overall FTE percentages, you're less than a point away from where we were at that point in time last year for the fall semester. So the interest is there. I can tell you that I think with some of the collaboration from SUNY Central and what they're doing to really push the power of SUNY, we're seeing even some early indicators for fall of 2023 in terms of our applications, what I would project out to be potentially 2 to 4 weeks ahead of schedule from where we have been last year as well as 2 years ago. And I think certainly as Trustee Lenahan has known, there are some initiatives that we're doing with regards to marketing to capitalize on that further as well. So I think with all those efforts in place, I think it really does show that there's an interest once again in Erie Community College. We are identified as I think a destination of choice. And that's represented by the number of new students that are looking to come to us and the fact that that is a relatively strong number. Where I think there's significant opportunity, and this was mentioned at the Senate as well as constant conversation with Andy, with Adrian, other members of the FFECC leadership, is what can we do to engage students and get them then registered on an early basis to engage with them. And we are seeing some, I would say, great discussion about that. There was a part of the Senate where now enrollment is discussed and what can be done to give faculty and equip faculty with the resources to be able to help contact their advisees, build these engagements, and Colleen did a great job, of showing how to get a report that every faculty member has access to. And I think that ability to empower our institution to really engage with those students is going to make a big headway in the way that we can get those students registered and have them persist and have them continue. Because you do see here that our number of continuing students year over year, that was arguably the area of the higher ed category that is an opportunity to grow with. If we go down a little bit further, we will then look at, this is just a visualization of the overall data that was very similar to what we saw in the last few reports. And where we are in terms of spring 2023 at this point in time last week is the following. So you're seeing that compared to last year within what I would say is similar margins of where we were for the fall semester, between 3-ish% or so. And one of the things I want to highlight about that is recouping what I would argue after then the snowstorm that happened in November. We were trending very favorably at that point in time relative to last spring. Once the snowstorm hit, we did see a precipitous, I would say, stabilization in terms of our numbers. They didn't really grow at the pace as what we had seen in years past. So the fact that there now was that ability to rebound, I think that is really a testament of the faculty working together across the institution. There were pop-up registration events that were held at the South Campus, North Campus, and City Campus. I've heard a lot of great anecdotes from faculty and students, especially with the South Campus one that was faculty-driven. It was talked about at the Senate. We were able to get the Student Government Association, SGA, involved as well, and really trying to build this as a institution-wide supported event. And I think that type of engagement is what I'm excited for. The other thing too I really love is that it wasn't something that even myself came up with. This was something that came from the bottom up. It was something that was organic and again faculty-driven. And I think that's the type of initiatives that as we build on those and the conversations that are being had, that'll help then with our enrollment as we move forward.
Eric, quick question. I know nationally there's been a huge, there's been like no other, the dropout rate among four-year colleges. Are you able to capture, is there like a way to find out if we're getting any of the dropouts from the four-year schools? And if so, are they worth targeting?
So a few elements I can discuss about that. So we have, as part of partnership with Buffalo State in particular, where students that are identified as either on academic probation or a warning system, we are identified as a destination for them to regain those competencies and help them to be able to continue their education moving forward. So that happens on a semester by semester basis, so every fall and every spring. We just received our new cohort beginning in December of students that may see us then as that next destination. So that's one. One of the other things that I would say that we are seeing as an indirect correlation to that is our spring 23 number of applicants at this point in time is higher than where we were 2 years ago and trending very similar to where we were pre-pandemic. And so that's our spring 2020 numbers. And I want to highlight that that would be looking at our number of applicants in the fall before then the quote-unquote shutdown happened in March of 2020. So I think based on that, we are seeing potentially an opportunity of either students that are then coming or transferring from their institution here as part of those new applicants.
That's fantastic to hear, just because I know that there is nationwide a huge issue with community college as well. So it sounds like we're doing above average.
And I really have to give a lot of credit to the admissions team. I mean, Phil, I think now being able to have that opportunity to focus on this, the admissions counselors, our processors especially, we're seeing the ability to get those students admitted. And it's something that I'm really proud of and indebted to the hard work that they're doing now that they can fully commit to that. And I'm excited to see where we are compared to where we have been in the last 2 years.
So I think that one of the opportunities, this idea of retention is the new enrollment, it is very real. So one of the opportunities that we have as a college to do better and more and really create a college-wide is that retention, persistent retention effort. And so that's another area that we will focus, similar to what we did with the enrollment strategy that Eric has put together with the college, is how do we do that as it relates to persistent? Because our stop out is a concern, right? We have a lot of students out, and we have data to indicate that. That stop out or were pushed out for whatever reason, right? So how do we get those students back so that we re-engage those students? But more importantly, how do we keep those students that come, particularly in first semester or first year, how do we really engage those students to make sure that their experience is top notch so they're staying to the point where we get them to complete? So we have a lot of work to do. Our framework will be through the curriculum student diversity committee is really using guided pathway as a way to talk about advisement, and I don't mean registration, I mean really a holistic advisement, working with the faculty to develop advisement model that is really customized to our college, but more importantly to our students' needs. So we got some work to do there.
Yeah.
So I know there is some who say this is not our role. However, I feel that the community colleges can play a role in the high school level by tackling some of this literacy issue. Many of the students aren't graduating or they are graduating reading well below level, as well as performing mathematically, which even so they'll graduate, they'll apply at SUNY Erie, they'll get in, but struggle because they're not equipped. I'm having this conversation at the high school level when they're saying what happens when the kids come to us unable to read and write at proficiency levels, and I say it becomes your issue once you accept them into your programs. So what can we do preventatively to address, or to address this issue? Can we partner with our local high schools and literacy organizations or teams or what have you, even if we have someone in-house, I don't know. But to basically get the students that we are trying to get in our pipeline up to speed. And I'm not just talking like, urban individuals. This is happening rural. This is also ESL. This is across the board that we're struggling with that. And I feel that if we are reaching down or reaching back into these arenas, we are again strengthening that pipeline. So when they do come to SUNY Erie, they are more successful or have a, they will be more successful because they can keep up and know that this is the place for them. I think Northland had a similar issue where they were trying to enroll students who could not pass the math equivalency or the reading and writing equivalency. However, they were diplomaed. They received their high school diploma. So what work can we do? And I know it's again, the argument is this is not the role of the community college, but I think it is
I agree.
to come back into those systems.
So two things. Number one, I think the actual awareness, right? Learning poverty is real, right? And COVID kind of, magnified that, right? So what does that look like for us? I think we have a great example for that, actually, working with Northland to really address the gap. But I think being aware that this is an issue for education, not just higher education, but in general, that this is real, and how do we make up that time for those students and make sure that there's still opportunity for them to have access. So I think Eric, maybe you want to talk to that?
Yeah, we identified, you mentioned Northland, so I smiled. We are in the process, if it isn't already scheduled for this, is the students that are going into the programs for the fall 23 are going to be participating, and everything's moving towards participating over the month of August in a pre-collegiate program to help them with English, math, as well as an option for ESL as needed. And I think that's a really great way to pilot it, as to promote that program as well and see what can we do to even further expand that as part of our Pathways program integration.
Good.
Can I make just raise a point as well? I love this idea of this August preschool period where we're going to work with these kids. I also think that the issue of mental health, the generic term is thrown around a lot today, but some of the conditions that people live in and some of the issues that are raised in the family make it hard for kids to focus, make it hard for them to really be prepared. And I think if there's some way we can screen, and screen is a neutral word. The idea is to work with these kids, somebody interview them, and there's got to be a way we can reach kids that aren't prepared because they're traumatized, or they're witnessing domestic violence, they're witnessing horrible things, and it draws kids away from their mission, which is to learn. And I'm not saying this is prevailing in every case, but I think it's an issue. I think there's a reason why a lot of these kids just can't. It's not that they're not intelligent, not bright, they're not focused. They're not paying attention.
No, Len, I think you're making...
They're trying to survive as opposed to thrive.
I think you're making such a good point. I think that we do need to... Mental health has been a huge issue, post-secondary across the board. But I also think that there's something that we should be doing. There's more that we can be doing at the post-secondary level. Number one, reassessing these tests and understanding whether or not they're actually adequately aligned with the skills necessary that are required within these competencies. I mean, just thinking about our placement exams and these competency tests. If you look at the historicity of them, they have been used to filter students out, and really looking at what they're requiring. I mean, if we just look at calculus has not been necessary since Sputnik. That's an industrialized type of a math that was used just to create hierarchies. And now that we've had a data revolution, people are moving into data science because that is the type of math that we need for cybersecurity and all these other pieces. So just in terms of aligning test, placement tests, competency tests, going back to rethink, okay, what are these tests really testing, and what skills do I actually need? Because 90% of the jobs, people can be trained for. In the 60s, this whole testing system is relatively new, and 60s, 70s, 80s. What did people do before then? And guess what? They kind of figured it out. So I think that in the post-secondary level, it is our responsibility and our job to go back and say, okay, of this, what is absolutely direly necessary within this test? And can I take this kid and train him, and get him to where he needs to be? Is this test what is the test really for? Because based on my research, the test really became a big deal in the 1980s as a quality control when more access was given and more opportunity and way more people started going to colleges. And so people started being worried about jobs, and then we started getting tests. Do we not need the test before? I'm just saying.
Yeah, I think in the article of the weekend, Canisius is doing away with some of these tests.
What are they testing?
Right.
I don't know if you talked about this, I'm sorry, I stepped out for a second, but we're an open enrollment institution, and we're required to prove that students have the ability to benefit for our programs because of financial aid concerns. So that really, the testing does play into safeguarding the students' interests when it comes to their loan program. So the testing that we do is to make sure that they're qualified, to be competent in those college level courses. And Eric has a great, under him, the Pathways program to help those students get prepared for classes. We have all of these things in place to make sure that students who may not prove the ability to benefit are remediated before they get into college level courses, so they are not wasting their loan programs and things that allow them to go forward further in their education down the line.
Kathy, I think that you're making a great point. But what we've seen with the students who are remediated, only 10% of them actually go on to get a 2-year degree in a 3-year period, or a 4-year degree in a 6-year period. Only 10% of those students. However, other reform strategies across the board, post-secondary, both in community 2-year schools or 4-year schools, have been co-requisites. So students who,
we have
which
that
is
too.
nice,
So I think
and I
Dr.
do know
Mills,
that.
if you could talk about our co-rec program, just so you're familiar, because I know you're new to the board and the college. But our testing is really only for students who self-identified with a GPA at this point, and then we have co-rec programs to allow them to sit, students who might have had a great, decent GPA, normally would have been put in our placement testing process. We now have co-rec programs in math and English, and I'm going to let Eric talk about that.
So quick question. So because you're using the GPA and then these co-recs, so are students still having to go through these placement tests?
Only students who self-identify or who don't have their high school or have a GED, I believe it is.
So when you say self-identify, they say, I don't feel ready to
Yes.
do these harder
Based
courses.
on their GPA and their own personal experience.
Got it. So I did study that as well, and what we find is that those students, they typically underestimate their capability, and they're also usually women, Latinx, and Black.
And that's where our advisement model helps.
Right, but they're still the ones who go and kind of get stuck into these systems. So, and Kathy, I love you. I think you're awesome. And I just love the work that you do. But yeah, there's a lot to unpack. But I think that what ECC is doing is tremendous. And I think we've talked about some of this, which is great. Mhm.
What I'd recommend maybe is that we have the team that's been working on placement testing and our co-rec models come and give a presentation, because I think you'd be impressed with the work they're doing and the research they've used to do that.
I've seen the data. I think it's incredible, especially within this last year, like the amount of students who've actually, like your, is it the input? The something throughput rates. But yeah, I think that what you're doing is tremendous.
The faculty team has done a lot of work, and I think it would be worth your time for them to come and give that presentation.
Could I just, one other point. Could Pathways, since what I love about Pathways is that it starts in the high schools and we're dealing with kids still in their formative years. Isn't there a way Pathways could work with, and I'm talking district-wide, or I'm talking county-wide, I'm not just talking about the city or any one particular area, but the entire community, to sort of come up with a system to identify kids that are not having a hard time thriving. They're just basically showing up in school and, not functioning very well. There's got to be a way to reach some of those kids. Now, I know high schools are swamped with 3 or 4 guidance counselors for a school of, 600-700 kids. They don't get a lot of time with guidance and things like that. I think if there's some way we could come up with, Eric, some way of including in the pathways, this is probably a discussion that's maybe far off, but just to identify kids that are, it's not just that they're not passing their scoring on reading and math, but they're just not, they're not delivering at all. And they're, in our day, it used to be called yellow cards. You get yellow cards instead of white cards if you didn't. And that's an area we can identify as a problem area. So it's just something to think about at long range. We're probably talking a few years out here, but it'd be great if this Pathways program, which is right in the high school, could be looking at other issues other than math and reading scores, and identifying issues these kids might be dealing with.
One more quick thing. So the co-requisite model, it has been able to increase, I think it went up from a 10% pass rate in a 2-year period or to a 40% pass rate when instead of doing the remediation, putting students directly into those co-recs. So just financially speaking and retention-wise, if we were able to kind of look back and look at some of that data, and I do have that available, that would be able to increase finances if we have a student that can stick with the full 2 years as opposed to drop out. So some of the models that I've seen have gotten rid of the placement test, put these kids directly in a co-rec course, which offers that remediation in addition to that college level class, and those kids are 40% more likely to finish, which is huge, and the numbers are growing.
Denise, as chair of the Student Success Group here, do you embrace Kathy's proposal to have this be presented at our next board meeting?
I would actually want to talk to Dr. Sagai and kind of go over that agenda and then maybe vet that through
Handle it at your committee level?
Yeah, and then
let us know.
We can come back. I feel that is valuable, but I just want to make sure that all presentations are aligned with.
Okay, that makes sense to me. Is that okay, Kathy?
Absolutely.
Okay.
Yeah.
All right, well, let's run that through your committee, and then there's an open invitation, I think, among the board members to hear more about this at our meeting. Here's where we are in terms of strategy, time, quorum, and so forth. Trustee Phillips has an ETA of 10:35. If we are at 6, I will convene a formal part of the meeting and will address as many of the more regular items that need action as we can until we lose 6. The likelihood of an executive session is diminishing, and we may have to have a special meeting next week. If we can manage it, I'll do that, but we'll have to just see how long we can sustain 6. So that's where we are on that. Pardon me? Yeah, go right ahead. Yeah. Still in informational mode only. And Len, as Mike is presenting, feel free to chip in by way of a report from your committee or your takes on this.
Sure. We met yesterday, actually.
Okay.
Eric and Mike and Adiyam and maybe a couple others.
Okay.
And we talked about this new structure, with the whole marketing and communication strategy. And of course, it's going to be highlighted by the hiring of a private vendor. And I think, Eric, is that going to be discussed later? Or
The details of
we're going to hold that off till January.
That's correct.
Right. So anyways, we talked about yesterday the RFPs that went out to local marketing firms, advertisers, and there's a consensus by the people who interviewed them that we have somebody we're interested in. We are also simultaneously interviewing candidates to be marketing director. It's not going to be a senior service level position. It's going to be in the union as it was before. There's a few concerns raised that maybe this position is not salaried at the right, it's maybe not real competitive salary, but nonetheless, action's being taken to make a recommendation at sometime in the near future. Mike has been kind enough to advise us as we go along here, and working with Eric, as to, the proper issues to take into consideration here. And I'm confident, I think for a long time, we have not put enough emphasis on the marketing strategy of the school and do it in a multi-level way. We've had a marketing director at times, then at other times one time we had an advisory board that helped out a little bit, but there has not been a real heavy-duty focus on marketing until just the last number of months. And I think once we do come to terms with the firm that we want to bring on and get a marketing person on ground, day-to-day, working with other people in the community who have expertise in marketing, I think we're going to be at a better place. With that, that's my take from there.
Yeah, and that's a large chunk of my report, which was in your packets. But once that decision was made to back burner that vice president level position, we realized we had to move forward to get these resources in place. Because right now your marketing office is 1.5 people, and that's the office that drives your revenue. So we do have to fix that one way or the other. So I'm very pleased with that we have made relatively quick progress given that, and look forward to coming to you next month with that recommendation. But that will address a lot of the things that we've actually just been talking about in many ways too. I think it's fair to say that the typical high school student is well aware that ECC exists at a very general level. They know this is an option. They might not have that granular knowledge of the programs that are available. Where we've been lacking as an institution is the ability to market at that granular level. We've been doing nothing but mass media type tactics. And a billboard is great, a TV ad is great, but it's too expensive per unit, per set of eyeballs, to talk about specific programs, to talk about culinary or paralegal or something like that in those media, because it's just you're not making the best use of those dollars. But the ability to get into this much more of a digital approach gives us that ability to do exactly that. We have programs that are the only ones of their kind in the state, and many of them are 100% online. So why wouldn't we be advertising online for that specific program, oftentimes to a non-traditional student? And that's where that needle can really move for the institution. So I think the good news is we've been able to maintain the budget so that when we do bring this partner on board, they'll have a meaningful amount of dollars to work with to make a difference, and that's very encouraging. As Eric showed you, we've been having actually good success in the spring enrollment area, and we have done a lot of push recently on that, especially using our own channels. We have taken advantage of a couple of nice media opportunities that have come our way. Erickson was actually quoted in last Sunday's Buffalo News, if you saw that, I think in a very positive way. We're currently working on the Buffalo News on a feature story that would highlight our cannabis program as well. And then I think something worth just touching on again, we talked about the importance of mental health a couple of times. It was highlighted very prominently yesterday with the death of a very famous celebrity, very unexpectedly. We just launched, in partnership with our student affairs team, a new mental health support app, and Amy Yoder actually came and gave a great talk at University Senate 2 days ago about the relatively quick adaptation of that. I think she said 1,400 app downloads have already been done from this. So this is a mental health support app that people can put right on their phone. It's available to all students, faculty, and staff. And I think it's a wonderful new addition that we've had here.
Do you know the name of that?
It's called Oasis.
Okay.
Yep, and if you look on our social media channels, about 2 weeks ago, we launched that coming right out of Thanksgiving.
Okay.
And so those are really the big things. I think everything else has been touched on one way or another prior.
Thank you, Mike. Appreciate it. There is is an informational council membership list on page 26.
Yep.
Adiam, could you speak about that? I think that's informational, but if it needs action, we will take it when we get 6.
It's information, and that is really our advisory board composite that we have for the college. As you know, advisory board is an important component of what we do, particularly in the academic area, where we have programs who have advisory board who are in the industry as well as in K-12 as well as post-secondary, to really inform our curriculum and our delivery. So the list of all of the advisory boards and the individuals and their credential is listed on page 27, just so for you to look at, but it's a huge component part of what we do. It is critical as it relates to our accreditation, middle state and other accreditation, to have industry advisory board to inform our curriculum, to make sure it's relevant, to make sure that we are collaborating. One of the things I think we have an advantage is really with workforce and other areas of the college is to really look at the list and the companies and organizations that are part of our advisory board to really collaborate so that we are maximizing the opportunity that we have. So quite often we have people who are sitting in our advisory board. They may also be participating in the foundation. They may be also participating in other part of the college. So how do we bring those individuals or those entities together to maximize their feedback to the college? One of the areas I think is worth looking for us to do is that on the student affairs side of the college, to really expand that, to really be intentional about creating an advisory board concept similar to the academic side of the house, to also ensure that the type of services that we're providing to our students and what that looks like is also relevant and not something we just are deciding only by ourselves, but really getting the input, the necessary, similar to the mental wellness or health wellness. Having those individuals or those organizations be part of an advisory board on the student affairs side will go a long way in terms of some of the services and things that we could provide the students.
Okay. Thank you. And then
Is Carrie?
as far as the human resources transaction report on page 22, I did not notice anything that I felt needed to be brought up at the meeting. But Adiam, if you feel differently, you could draw us our attention to any of those. They look like a pretty standard set of new hires, rehires, resignations, and so forth.
Right.
So that's again for our information.
We do have one on HR that we need to approve.
Hi, Carrie. How are you?
Easiest boots of all time going down this hallway.
I am going to take advantage of this.
Let's call the roll.
Yes, and I'll spare you, Carrie, from having to call the roll unless you're ready to.
I have it, I'm ready.
Okay, go ahead.
Melody Baker.
Here.
Len Linehan.
Here.
Amanda Lowe.
Here.
Candace Morrison, absent. Carrie Phillips here. Jeffrey Stone.
Here.
Denise Wilson.
Here.
Marcel Suarez Pinheiro, absent.
Okay, we have a quorum present. Having noted that, I will declare an end to the informational and broad discussion portion of the meeting and move to a section of the meeting where we can actually take official action. And I'd like to do that rather expeditiously because we have a number of items, some of which are relatively routine, that I think we should just take care of. The first of those I'll propose is the revision of our calendar of meetings. I think I'm on page 47. And if you'll note, February 16th is now the meeting in February, changed from February 23. We've changed from August 31st to August 17th. And if everyone is fine with that, and I believe everyone is, I'll have a motion to accept that
So
as our
moved.
movement. Second?
Second.
And any discussion? And if not, all in favor say aye.
Aye.
Any opposed? Okay, we've adopted Kelly, the list is now approved, okay? Let's talk about the AAA defensive driving course. When I reviewed that, it seems to be pretty straightforward,
Yes.
connecting back with them
Yes.
after COVID.
Yes.
Any comments you can add, and then we'll vote.
No, it's another great opportunity to continue our partnership with AAA.
Okay, we're on page 25, and I don't think there's anything controversial
I'll
about
move
that.
approval.
Yep, second?
Second.
And any further discussion? If not, all in favor of approving
Yeah, let's not waste any time.
the agreement with AAA defensive driving, say aye.
Aye.
All opposed? Okay, Kelly, that is approved as well per the discussion on page 25 and the summary, executive summary. let's just make sure. We will approve, let's take the minutes from November 17th, 2022, regular board meeting, and the special board meeting on November 22nd. They're in your materials, page 5 and page 11. I've reviewed them. The only comment I had, Kelly, is that where you refer to presentations by the president, it should be to the officer in charge if Dr. Sagai is making the report, as the title. You just changing the title there. So I will, with that amendment, unless there's further discussion, I'll take a motion to approve both the November 17th, November 22 minutes.
So moved.
Second.
All right. Any further discussion? If not, all in favor say aye, please.
Aye.
Aye.
Any opposed? No. I approve. They are approved, Kelly, both sets of minutes, as I mentioned. Human Resources Agenda, page 14. Let's go to Adium for that. I looked at that, and this is the situation with Colleen Reed.
That's right. This is a position, Vice President of Workforce Development. We have a candidate who went through all of the process in terms of getting an interview. We would like the board to approve this. This is an important position for the college, as we have an opportunity to really expand our workforce area of the college. And this individual has the appropriate skills, the appropriate network that we need to really expand our workforce development of the college. So we're asking for your approval.
This has been before us for a month or two, and so I have no personal concerns about this. But any other questions, comments?
She's phenomenal.
Oh, you know her?
Yes.
Good. I don't think I do, but the name seems familiar.
She's been in this space for a while. She knows what she's doing.
Good. I'm glad to hear that.
Incredible.
She used to work at ECC too for a while.
Yeah.
Anyone else wish to comment on the proposal? If not, Melody, would you like to make
the motion?
Okay. And second? All right. This is for the approval of the hiring of Colleen Reedy as proposed and as set forth on our.
Can I just one quick question?
Yep.
What was the, I mean, I'm sure this person's very good, very qualified. What was the process for,
Oh, okay.
how did we reach the determination that she was the one?
So the position was posted. We had applicants. I'm not sure how many applicants we had, Cynthia, but we had about 10 or so applicants. Out of that, we interviewed, I believe, 3 or 4, and we had a committee. Annie Sacco was part of that committee, and myself and others. She went through. We had a set of questions.
Is she an internal person?
No.
Okay.
Colleen Reedy, but she was here a while ago.
Okay.
But she works for another institution, and we went through the process, and she was the candidate that came to the surface. But we have all the documents to provide.
But there was a panel interview.
Absolutely.
There was, and
Yes.
point scoring system. This is something I was aware of between meetings as well.
Yes.
Right.
So I'm sorry to be quick about it, but I had satisfied myself that it was quite a process that led to this
Right. No, that's
presentation.
good. I'm good.
Yes.
She was a partner when I worked at United Way. I think she worked at Bryan and Stratton.
Yes, she did.
She brought tremendous programs between Bryan and Stratton to the high schools in the local area. I just, so many different programs, and I just couldn't believe there was a person who came out to me as the education director.
She'll be able to connect with employers. and-
Oh, she's great.
Right.
Like, she's great.
Great.
Anyone else in the room familiar with Colleen Reedy? Okay. Yes, again, this has been discussed several times in various meetings, so.
And I didn't know up until now. I had no idea until you mentioned her. What? How did we get her?
Good. Good.
Well, it's an important job.
Yes, it is.
So we have a motion to accept the hiring as proposed and a second. Any further discussion? If not, all in favor, say aye.
Aye.
Opposed? All right, that's approved.
Thank you.
And we appreciate that addition to the staff.
Absolutely.
We've done the defensive driving.
Oh, we have one more.
Yes, go ahead.
Within the HR, Kathy Calesto.
Ah.
She's taken a leave from the faculty role. As you all know, Kathy was a full-time faculty in architecture. So
Right.
we're asking the board to approve her leave that she was granted by the Faculty Federation.
And that, just to be clear, doesn't mean you're going away anywhere, does it?
No, and so I can continue in this role for the time.
That's how I interpreted it, but I did have a moment last night where I so, just sharing that with you.
Thank you.
I am glad that leave does not mean we will not see you, but we certainly are willing, this is a technical adjustment that we're making,
It's
right?
just an extension of the leave that the faculty granted me from my teaching position. So I can return.
Yep.
Okay, fine.
If she wants, yeah.
I know it's so close to home. All right. Kathy, thank you for all your service. There's been many times when your reports have been very meaningful here at Trustee, and not least of which was getting our accreditation and the standard 5 taken care of. So tremendous. And yes, so we need a motion to approve Kathy's leave from the faculty to continue work at the level she's at.
Second.
Lynn, second. Any further discussion? If not, all in favor, please say aye.
Aye.
Opposed? All right. Congratulations, I think.
Everybody's on board for that one.
Yeah. Whatever Kathy wants. All right. No, I am glad about that. Now, there were some minutes. I'm just going to quick look. We have curriculum, student success, and diversity. That's Denise, and we have for the board's approval. We already did that. Let's see. I just want to make sure.
Policy.
Oh, policy. Okay. Informational minutes we have, and I read those. Do we have any action item there, Denise?
I see 3
Yes, for policy.
Where am I looking? Sorry.
for under policy. A little
Oh,
further
I see.
down.
I gotcha. Oh, yes, those are important. I think I'm going to have to go. I've read these and highlighted them, but I think Adiam or your
Yes, sure.
designee will have to tell us exactly why we're looking
So
at these.
I'll take the first one, and then I'll have Paul do the second. The tuition liability refund policy, the only change on page 34, where we had the registrar's office was approving this process, they're just processing it, not approving it. So it's just a language change. So it's on 34, we changed it from approve to process. They're not the office that approve it, but they process it. So that was the only change for that policy.
Melody, that meets with your committee's approval?
Yes.
Okay.
And then 2, Paul, you want to speak to,
Sure.
please?
This policy is to enable the college to use its facilities for commercial use. Currently, New York State education law enables the college to use its facilities for educational purposes only. The college currently allows use for other outside organizations, but those are all educational in nature, like People Inc. Ford has a program, Raytheon has a program down at the Vehicle Tech Center. This policy will allow the college to set parameters to allow use for the facilities by outside entities that aren't necessarily educational in nature. We modeled the policy after SUNY's commercial use policy for its state-sponsored schools. It was originally adopted by SUNY in 1966, amended in 73 and 79, most recently in 2012. And it opens up the opportunity for the college to generate commercial revenue. Specifically, we're looking at the Turner Gilbane and the other entities that are going to be associated with the Bills Stadium project.
Right, and I noticed this is actually encouraged by SUNY. This is not something that runs afoul of
but
them.
this is one of like the 3 steps we have to do
Right.
to actually put an agreement in place.
And ultimately, agreements of that nature would come back to the board.
Yes, it will. I'm hoping that it would be.
But this would be-
January.
Okay.
We've already gotten a fair market appraisal for the areas under consideration, so we've kind of checked that box. This is the second box to check, and then the agreement would be the next.
Okay, Paul, thank you. And Melody, again, this is something your committee's comfortable with?
Yes, I think it's fantastic that we're doing that. I mean, I just really commend you for bringing this opportunity for the college to work this way and to increase revenue. I did have someone reach out to me similarly about using like maybe theater space here at SUNY for the same reason. I was looking for the email, but I think that this is tremendous and a great opportunity for us. Make them.
Well, we're going to do all 3 at once.
And then, Dr. Nielsen, great.
Yep, number 3.
Yep, there's a proposal to rescind our current policy that's with the board with regards to placement testing. This policy currently dates back to 2000. Because of the policy that's currently in approval, that does restrict us on being able then to use current placement practices. So by rescinding this, that will then allow us to be able to then use best practices as well as update our procedure, which are in the catalog. Those will still be a binding agreement for the students that are in that cohort. as well as allow us to be able to make more timely changes. It's also more consistent with the policy on policy that we have, which would then update these more as a procedure as opposed to a policy moving forward. In terms of the concern about what Kathy said about the financial aid, we still are obligated to have a approved ATB testing, which we still do currently have as part of our placement procedure. So rescinding this does not then violate that anyway.
And this will probably be, this can be covered as part of what may be going through Denise's committee.
Yep.
And ultimately.
And that'll be allowed to do that. So we have through the Senate, a placement task force. Now that placement task force can focus on what the proper procedures will be, updating those as needed, and that'll then certainly allow us to be able to move forward in a more timely manner than that.
All right. My general thought on this, and I did read it, is again, a policy 22 years old is dangerously in need of review or extermination or replacement. So, all right. Any question on any of the three presentations, the policies that are proposed? If not, I'll take a motion, please, to approve these policies as set forth in our materials.
So moved.
Thank you. Second. And any further discussion? If not, all in favor of approving the three policies as set forth, please say aye.
Aye.
And opposed? These are approved, Kelly. Thank you. Now, Adiam, others, if anyone can help me, if there is more by way of approval that we need to do, I would like to take that up now. And if not, what I would like to do is have a call to go into executive session. It may not be long, depending on how long we can manage.
Right.
But that's what I would like to do. Is there any further items to approve for the good of the order?
I'll move to go into executive session.
All right, and that will be for the purpose of addressing at least two of the potential aspects of litigation, which are proposed pending or current litigation, as well as employment history of particular people and personnel matters. Those are the reasons we're going in. And I don't necessarily expect to take any formal action, especially given time constraints, but we will have an executive session.
I'll second.
All right? All in favor?
Aye.
Aye.
Thank you all who attended.
good, Jeff.
All right. Jeff Stone, Chair speaking. This is to let the public know that we have voted to come out of executive session. During executive session, we held discussions under point D relating to litigation and point F under the public officers law relating to matters of personnel and particular persons. So we took no formal action, so we are making no report of any formal action. And I will now accept a motion to adjourn the actual board meeting.
So moved.
Thank you, Len.
Second.
Thank you. All in favor?
Aye.
Very well. Thank you,
Am I,
everyone.
Am I good to go?